Good evening, everyone. It's Dr. Jennifer Freiheit with the Kenosha County Division of Health on June 3rd. I just wanted to take a quick moment to reflect on the events of the past week. Another tragic death, peaceful protests, and looting. And it brings a stark reminder that racism is a public health crisis. And I just wanted to assure you that the Kenosha County Division of Health takes health equity very seriously. We are there to serve our residents who are the most in need and to be able to bring equitable health services and access to care to the and underinsured populations, as well as others throughout Kenosha County. The COVID pandemic is still very much in existence in Kenosha County, and there are still people out there that need desperate help, from food to money to social connection to jobs and daycare help. And these are all things that allow people health equity. And so this is something we're hoping that residents are still helping out their fellow neighbors and residents to give them the care and services they need to still get through this pandemic. We are at 33 new cases today. That brings us to 1,244 positive cases in Kenosha County, and we are now at 34 deaths. Yesterday, we had a percent positive rate of 7.3, but the days before were 18.9 and 13.6. So as you can see, our percent positive rate is bouncing up and down depending upon several factors, including amount of testing and any other factors of what's happening in the environment. We are averaging 119 tests a day. We have now been testing 53.7 of every 1,000 population in Kenosha County, and we estimate that 65% have recovered. We remain very steady at a 12% hospital rate. And you may recall back when we put out projection modeling to the public, and the date that initially was put out was today. Now, of course, this was at the end of April, and projection modeling changes daily given different factors that get put in. It's all based off of what's called an R value, and that's an epidemiological value that sort of shows us what could be happening in the community. So different factors go into that. Certainly the safer at home being listed, Memorial Day barbecues and parties, these protests this week. It really is hard to say when we have hit our peak and when we are starting to come down that peak because of the factors constantly changing. However, over these next 2 weeks, the data will be critical. So we are really taking a look over these next 2 weeks to determine, have we moved the needle, have we moved anywhere on our flattening the curve, and where do we sit as far as being able to open up even more. So more to come in the next 2 weeks. I did want to answer the question about antibody testing. And it's very important because knowing the accurate spread of a virus across our community is vitally important for public health risk assessment, for development of mitigation strategies, and for preparing for the future. We are, I think I mentioned last week, we're obviously preparing for the worst, for a second wave that could hit anytime now between winter, when things could be detrimental during the middle of flu season. And as you know, it's very hard to tell the difference between influenza and COVID-19. So antibody testing is coming. We don't know when. There's still a large amount of research happening, but I want to caution that antibody testing is not confirmatory testing. And I'll repeat that, antibody testing is not confirmatory. We have been getting a lot of questions. People want antibody testing because they see it as sort of their ticket to freedom. If I have the antibodies, I'm free to walk about the community without a mask and get back to my normal life. But it is not confirmatory testing. There's still a lot of research happening, and the confidence of these tests is still fairly low. But it does help to provide an opportunity to understand how a virus is spread, if there is herd immunity, and the risk for future infection. So you may hear about some antibody testing that will be happening in Racine County in June, October, and January. They will be taking former health research participants. This is the Survey Health of Wisconsin, the SHOW research group, and they will be looking at this data that will help provide us some more information for do we have herd immunity and how future infection might look. So we'll be very much looking forward to this data, and you will be hearing more about that. There has been a big change in the symptoms that we're seeing in our positive cases. For example, the percent of people who have had a fever is way down. Of our total positive, only 38% have ever had a fever. Only 51% have ever had a cough. We're seeing new symptoms such as chills and headaches that we're now tracking. And 20% of our positive cases in Kenosha County have had chills, 30% have had headaches. So even a symptom as simple as a headache could be a symptom of COVID. And the biggest change has also been jumping from 12% up to 26% of our positive cases in Kenosha County have been completely asymptomatic. And we expect this number to rise as more testing happens, that more people are considered viral carriers, but are completely asymptomatic and don't know that they're shedding the virus. So this brings me to testing. With more testing, there's better data. And with better data, we're able to make better decisions for Kenosha County and open things up more. So CVS, Gateway, Kenosha Community Health Center, Aurora, and Freiheit South are still continuing their testing. Some of the numbers that we're expecting, especially at the hospitals, are a little bit lower than we might have expected. Kroger Health took a pause this week, and they will be back at Pick and Save for the next 2 weeks, next week and the week after. And we also have the National Guard testing out at Central High School, and that testing will continue through Saturday, noon to 8 tomorrow, 10 to 6 on Friday, and 10 to 6 on Saturday. We are adding another new site at Tremper High School. This is noon to 8 tomorrow, 10 to 6 on Friday, and 10 to 6 on Saturday. So both Central High School and Tremper High School are the National Guard. You don't have to have symptoms. You don't have to have an appointment. We are encouraging businesses to send their employees there. We are encouraging anybody who is at a mass gathering, whether that be a Memorial Day party, a birthday party, or a protest, to go get tested. We want to be able to see how the virus is spreading throughout Kenosha County. So these sites are for ages 5 and up. You can drive your carpool or ride share through. You can go as a family in a whole van. The National Guard has a very smooth operation, and people are getting in and out very quickly. So again, this starts tomorrow at Tremper High School, noon to 8, Friday 10 to 6, and Saturday 10 to 6. We are definitely seeing that the numbers at our community open sites, such as out at Central High School, are lower than we expected. And there could be several reasons. Could that be because people are more apathetic to this virus? Could it be because of the protests and people are staying home? Could it be because of its location? We can't say. And I think it could be a combination of all the above. So we're definitely wanting to figure out why the numbers are lower and what we can do to increase the testing there. We are hearing a number of people that don't even want to be tested because then they're going to be isolated for 2 weeks and they don't want to be away from their work. They need their job. So this is where we implore businesses to ensure and encourage that their employees get tested, and that if they are positive, that there's plans in place and protocols that allows them to stay home, allows them to hopefully continue pay, and to allow them to take care of their families if they have to stay home if they're positive, or to help them if they're a close contact and if they're quarantined. So I did receive a question this week that was, should places of employment surveil their own employees? And the answer is unequivocally no. A health department is the only entity who can put someone in isolation or quarantine. And, businesses we see are wanting to do this on their own. And they want to do their own contact tracing, and they want to do their own quarantining. But the guidance is changing daily, and it is our job in public health to keep up with that guidance, to keep abreast of the latest changes, to make clinical judgments and interpret what those changes mean for Kenosha County. Every single positive case gets a call from a public health nurse, and that's very specific by design because they are being able to answer clinical questions and educate the families. They spend a significant amount of time on the phone with positive cases and their families, basically talking them through their level of risk, what it means to be isolated and quarantined, what they can do to keep them and their families safe. So to have a business that would put their employees in quarantine does not allow the employees the opportunity to get all of their clinical questions answered by a nurse. And our public health nurses are spending anywhere from 1 to 4 hours on these positive case investigations. It all depends on the number of people that live in the household. How sick are each of them? How many places have they visited since they've been sick? if there's a language barrier and we have to use the language line interpretation services. So a lot goes into this contact tracing. It's not a simple one point, here were the 3 employees that were in touch, with this positive employee. We follow those contacts, and it's all part of boxing in the virus. And certainly customers would not want a restaurant owner or a, business owner to call and tell them, tell the patrons that they're a point of contact to a positive. This is where public health, this is our job. We're statutorily required to do such. So we do want to just keep encouraging that places of employment and businesses work with public health, allow us to do our job to protect your businesses, keep your businesses safe, contact trace any close contacts, whether that means if you're looking up credit card receipts or the patrons that have come into your establishment, and allowing us to contact them and answer their questions about COVID-19. And back to the testing, just having people being afraid of losing their job or not being able to go to work. So ensuring those policies are in place that are from the Kenosha County Kickstart Plan that say that we're still not back to business as usual. We still want to make sure that we can help businesses keep everybody as safe as possible, and policies is one part of that. So I'm just going to check to see if there were any questions that have been put through since I started talking. I'll check my 2 sources here. And it looks like there are no new questions. So with that, I appreciate all of your time sticking with me today. Please spread the news far and wide about our testing sites, or go get tested yourself and experience COVID testing firsthand. So we do look forward to continuing to serve Kenosha County. We're going to keep doing our best to box in this virus. And I do think that there will be some critical changes in the coming weeks as we get better data and make some changes to our critical mission as a health department for how we're going to move forward and move into that harm reduction phase. So thank you so much, and go out and enjoy the rest of the night. Thank you.